Yeah, you're probably wondering how Mila got here. So apparently Mila has mumps. It's a contagious disease caused by the mumps virus, which belongs to a group of viruses known.
I'm feeling a bit bad, but here it's still swollen.
And how does that make you feel?
I don't want to be sick anymore because I want to be normal.
You want to be normal.
Yes.
You want your face back.
Yes.
You'll be fine, baby.
I just don't want a swollen mouth. I just don't want a swollen body.
You don't want a swollen face.
I want to stay like beautiful as this one.
Oh, baby.
Oh, stop pain.
Belongs to a group of viruses known as paramyxoviruses. The illness starts with mild symptoms such as headache, fever, and fatigue, but then it typically leads to severe swelling in certain salivary glands that causes puffy cheeks and a tender swollen jaw. Virus, it's called mumps, and it's a virus and it's very contagious. So when you stay close to Zian will be sick too. Baby, do you know that? You know why I'm separating you from Mila?
Zian. Okay, tell us.
So you cannot stay close to Zian, or you cannot share the water bottle, you cannot share the spoon, you cannot share the cup, because it's a contagious disease and it will make Zian sick also. And we are trying to prevent that by separating you guys. Since the swelling started, when did it start?
Yesterday.
No, it wasn't yesterday, 2 days ago, I think. The day before yesterday. When did we go to the hospital?
The day before Monday.
Oh, wait, let me see. Today is Thursday. Yesterday was Wednesday. The day before yesterday was Tuesday. I think we went to the hospital on Tuesday. So until a week, because this swelling will go on its own. Apparently there is no cure for it. You just have to take painkillers to reduce the pain, like Brufen, and you have to stay away from aspirin medicines because they are very, very dangerous. But you're gonna get back to normal after a week or so. It depends with how your body is going to fight this. Okay, baby? Yes, so you have to drink more water, you have to stay hydrated and take your painkillers to reduce the pain. And then I'm going to press the warm compressors on your neck and cheek. So mumps commonly affect children between the ages of 2 to 12 who haven't received the mumps vaccine. But still, the best way to protect against mumps infection is to be fully vaccinated. It can also affect adults, by the way. The mild mumps symptoms may include fever, headache, muscle aches, fatigue, loss of appetite, and the swollen jaw. And in some rare cases, mumps can affect your organs, including brain, pancreas, testicles for guys, and ovaries. But this is very, very rare. If you notice high fever, stiff neck, severe headache, confusion, stomach pain, vomiting, seizure, see the doctor.
Mom.
Yes, baby.
Is Mila sick?
Yes, he's kind of sick. He has mumps.
And they have virus.
Yes, it's a virus.
Why does people always have virus?
Sometimes we don't know the cause. But let me tell you that it depends with your immune system. You see, if you have a stronger immune system, some sicknesses cannot get through you. You understand? So you need to eat more fruits. I know you don't like fruits, but you have to eat more fruits. You drink more water.
Yeah.
Yes.
If she needs
Sit
an
upright.
apple, orange,
Sit
banana,
upright.
strawberry, mom, go.
Oh, so where else is paining?
No else?
Just.
Yes.
What causes mumps? The virus spreads from person to person through direct contact with infected saliva or through respiratory droplets, from the infected person's nose, mouth, or throat. So the infected person can spread the mumps viruses by sneezing, coughing, or talking, or even sharing objects containing infected saliva. Mila, let me tell you, when you cough, when you talk, when you sneeze, it gets through someone. It's like an airborne disease.
What?
Yeah.
So
when you want to sneeze, what do?
you cover your mouth.
How? Good. That's how you sneeze. That's how you cough. Okay. Is mumps contagious? Yes, it's very, very contagious viral infection. If your child has mumps, they are contagious from a few days before their glands swell up to 5 days after the swelling began. Therefore, your child should minimize contact with others. They shouldn't go to school or childcare. Up to 1/3 of people with mumps don't have any symptoms, but then they can still be contagious.
Well, oh my god. Like mommy's where's my leg so fat, God? What?
There's no specific treatment for mumps. The disease must run its course and usually goes away on its own within a couple weeks. Mumps treatment focuses on alleviating your child's symptoms to make them as comfortable as possible. First, you can drink plenty of fluids like maybe water. Let me just say specifically water, and take more fruits, and then use ice or heat to ease swelling and discomfort. Then you can use non-aspirin medications that can be used to bring a fever under control and help with pain from swollen glands. Most children recover fully from mumps within a few weeks, and once a child has had mumps, it's very unlikely that they'll get it again in their lifetime. The best way to ensure that your child is protected against mumps, however, is to make sure that their immunizations are up to date. Wow. That is so beautiful. Right?
Yeah. Yeah, but Papa John.
You did?
Yes, with Daddy.
That's okay, baby.
Even it has marshall shape. Guy! They are two guys. No one that fun. Guy for Sky. And Sky is a girl. Jack is wrong. Girl.
Why, baby?
Because
See you next time.
they went the car.